Hey, what's up? How you doing? So today on Post-Surgery Talks, we're going to talk about mask. Now we're going to move on to what is truly called a surgical mask. This is what I wear. This is what I've been wearing the entire pandemic. This is actually what I've been wearing for the last probably 20 years, since I've been a surgeon for about 20 years. This is designed for surgery. So it does a couple different things. One, it has a face shield on it. The face shield prevents me from getting anything from the patient's wound in my eyes. So there, protection. It also has a face shield that comes down over my nose, so that even if something comes this way, it's more than likely not going to get directly on my nose. The rest of this covers my mouth. This, again, is two-sided. You can see it's white on the inside and yellow or orange on the outside. The other thing that you can't see, I'll see if I can kind of show you the shimmy on it. This has a wax coating on it as well. So this is designed to catch and prevent particles of fluid from going through. So it stays there and then it kind of slowly absorbs. So it doesn't go all the way through. This is my preferred mask. I love it. I wear it. I probably go through 2 or 3 of these a day anytime I have operations. What I sometimes will do when I leave the hospital, or if I'm going to wear it outside, I will actually take this part out. As COVID has increased its numbers, I honestly have stopped taking this off, and you'll see me wearing this entire face shield out a lot of times. For me, this works the best. Now, there are some downsides with this from COVID. If you're sick, this does not protect on the sides, so stuff can't come out, but it does a pretty good job because it's snug, and if I sneeze it goes directly into the inside of this, so it works pretty well. Now the next step is a N95 mask. This is an N95. This is the classic one that everyone sees, green on the outside, white on the inside. Has a moldable piece here so you can make it fit your nose. This is a great mask and is designed to prevent the respiratory spread of anything. So if someone has TB, if someone has COVID, whether it's the patient or the person wearing it or a doctor, this is traditionally what you'll see us wear. This has to be fitted. The downside to this is my beard. Now this does not work exactly like it should with a beard, so that's one of the reasons I don't wear this one as often, but they do make some larger ones, and I did find one that covers my entire face. So it's a little better, especially if I'm sick or having a virus that's not COVID, respiratory virus or whatever. I'll sometimes wear this, or if I'm in a room with a patient that has COVID, I'll sometimes wear this if I'm only in there for a brief exposure. You can see my voice is muffled because this one prevents stuff going in and out. So there is decreased respiratory flow. You can't have an increase of your carbon dioxide if you wear this for long periods of time, but as far as preventing the spread of COVID this way or this way, this is probably what I would consider the gold standard. So this, but again, these are usually reserved for people that are in the healthcare field or someone that is doing something that is risky but is necessary. Now, there is one step above this. Don't make Well, I mean, you're going to make jokes anyway, but this is a respirator. So this essentially has a breathing apparatus that is similar to what you see on scuba diving that makes sure that all of my air comes in and out. This has those plastic valves that we talk about not being ideal, but the difference is that this has a changeable filter. So even when you breathe in and out, it still goes through this filter. So this is probably the ideal situation. These are very expensive. They're only used under certain situations. I have this for when I am doing sanding outside. That's why it's dirty, or if I'm doing some fiberglass work. But it's also great for COVID, and what you can do is just change out these. If I'm in a situation where I'm operating on a lung or doing a trach on a patient that has COVID, and we're going to be in direct contact with respiratory particles, this is what I wear. This is what also a lot of anesthesiologists wear when they're doing procedures like intubation on patients. You also see some GI doctors doing that as well when they are working on doing upper endoscopy or EGDs. So this is probably a little better, but again, bulky. You can barely hear me talking like this. And you can hear the valves working. So yes, so this is one that you would use in a certain situation, but it's not ideal. Now, what we had to figure out in my office was what I wanted the people in my office to wear that would provide them with protection, not break the bank, and also gave them a little sense of style, and that's what they wanted. So what we decided to go with, I don't know, where is that thing? Ah, here it is. So what we decided to go with in my office is this. So this is a mask that is a little different. So it has the moldable thing that you can get around your nose. Rock it like this. You can buy these anywhere and they can put emblems on them. It covers your entire chin, so you're getting really good coverage. This is 2 layers, so by itself, it's probably okay. But what we did was, this is nice because it has this insert. So you can actually take this, which is a filter similar to a N95, and put it on the inside of this mask. So once you put it on the inside of this mask, you now have essentially a molded face mask that has a filter in it to help filter particles. So this is essentially a 3-layer mask, or an N95 mask. This is probably better than my surgical mask. And when I breathe, I can't feel anything going through it. So this is actually pretty good, and I think this provides us with a good amount of protection in my office, and it works well. The only trick is that sometimes you have to manipulate the filter so that it comes up high like this, so it covers your nose and your mouth. But that's it. That's the one that we use, and this is the one that the young ladies in my office and the young gentlemen in my office, we all wear when we're there. When I'm doing procedures, I always go back to this one with the face shield so that COVID doesn't get in my eyes or blood doesn't get in my eyes. So this is what I use the majority of the time. This is what I wear when I'm sick. Now, back to the original question, do you need to double up on these? I would say that if you're in a situation where you are doubling up, you probably need to rethink the situation. 6 feet, social distancing, not enclosed spaces, not large groups. If you have to do something like that, then you probably would want to go with the N95 if you have access to it. If you don't have access to it, maybe doubling up is a little better, but again, it also depends on the quality of the face shield that you're wearing. If it's a cheap one, then yes, double up. If it's a medical grade one, or one that they would traditionally use in hospitals and you've paid a little more for it, then probably you are okay. I hope that covers everything. Thanks for watching. Subscribe, all that good stuff. You know the routine. Take care.